Why have I quit my job? Why have I, bought a van? And why am I going to drive around the country? Well, I'm passionate about the idea that you need to be heard. And I want to stitch these stories together across the states. We're going to find the commonalities. And it's going to be really an amazing experience. And I look forward to you joining me on the jar. Hello, everybody. Welcome back to Mental Health Today, sponsored by the JAR Foundation. My name is Ken Stearns, and I'm the host of this podcast. And this is all about finding people in the mental health space or people on the mental health journey and hearing their stories and really highlighting some of the good stuff that's happening in the mental health space today, and talking to people, really innovators and educators, policymakers, financiers, anybody that's in this battlefield of trying to help solve this mental health crisis that we've got going on. And today we've got Jen Padron with us. Hi, Jen.
Hey.
Welcome. And, after a few little technical difficulties, little timing, challenges, no problem. Here we are. Jen, welcome to the show. Thanks for being a guest.
Thanks for thinking of me, and thanks for inviting me. I appreciate being here.
Yeah, absolutely. Why don't you share with the audience a little bit about your work, what you're doing today in the space, a little bit about who's Jen in relationship to the mental health journey.
Sure. Thanks, Ken. Well, I live in DeKalb County, which is near Atlanta. I live in the Atlanta metro in Georgia.
Yeah.
And I've been in Georgia now for, since about 2012. I came here doing mobile crisis intervention. I've done crisis. I've done as a certified peer specialist in the state of Georgia with the Georgia Mental Health Consumer Network. I've been a peer since 2014. And so a lot of my life has pretty much been delineated and determined by my peer support, my peer work. I'm a certified peer specialist. I'm getting my MSW on May the 6th, so I can do social work. And at that point, I'm just waiting very anxiously to get the paper and the transcripts into these places so I can, move forward. Being a peer is a tough thing. Being a certified peer specialist in the U.S. is tough. And one of the reasons why I decided to opt to pursue social work now, in addition to being a peer, is because I want to be able to do more. I've just really felt like I've been ornamental as a peer in mobile crisis intervention or in the psychiatric inpatient facilities, where the peer, I guess, is great for peer support, talking to a person that may be in crisis or having a really terrific day. But there's only so much that we can do. And so I decided to just go and do the schooling, and I've completed about 4 years now. And so I get I'm conferred on the 6th. I can't wait.
Oh, that's and what does a peer do exactly for maybe some people listening and they're not familiar with that?
A peer is a person who is with lived experience. I live with the mental health experience. I have long-term recovery and mental health recovery as well as in substance use. I came to this place in mental health from years and years of being really sick. I unfortunately, mental health, one diagnosis in particular, which I'm kind of unsure about whether even to mention, but bipolar disorder runs on my father's side, with the males actually in my family. Okay. And so there you see quite a lot of it, as well as OCD, depression. A lot of my father and my 3 uncles were all in the Vietnam War in service. And I know 2 of my uncles came away with a lot of issues and just really harmed and had a difficult time getting back. And so a peer can cross over many, many different roles. Okay. I've worked really hard to help make the certified peer specialist a standard in a lot of different states like Texas or Maryland, or helping with Oregon, and now just being in Georgia, just letting other people do the work. But a peer works with you either one to one, face to face, or they also hold groups, group supports, group therapy, meetings. We produce a lot of different things. We write papers. We speak. We're active with groups like NAMI or
Okay.
DSA or Mental Health America. And the training that certified peer specialists usually receive nowadays is in Wellness Recovery Action Plan, WRAP, by Dr. Mary Ellen Copeland, who's over in Vermont, with a good group of people, and as well as intentional peer support with Chris Hansen, Sherry Mead, and so IPS and WRAP, and as well as Whole Health Action Management, WHAM, designed by this gentleman called Larry Fricks, who taught me my Texas and Georgia peer certification. Came up with it when he had the Appalachia Consulting Group. So a peer is basically just a person who's been there. Our primary objective is to espouse experience, hope, patience, because we've walked through the fire, and we made it out to the other side of the tunnel. I've told a lot of my peeps that I work with in one-to-one or group that the only difference between me and you is that I made it out to the other side of the tunnel and you're still in the mud. But here's what we're going to do. You're going to keep walking, and you're going to get out, and you're going to see that light in whenever you want to and when you can. So there's really no difference between me and the person that's out there, still out there in the struggle, or might be on the streets or whatever. The only difference is I made it to the other side because I had family, I had support, I had great partners, I had friends who cared about me. And that I think that's really a big difference between a person that's going to do well in recovery, or not, or just have it be a big struggle. And I see that a lot with people who are in crisis or in hospitals, crisis stabilization unit, or inpatient facilities for treatment for whatever might be, that you might be walking through. Is that you're still in the mud, but you're on the right track. You've got to get through the mud to get to the other side. That's just how.
Yeah. What is the peer? I mean, there's a shortage of therapists. There's a shortage of access. There's cost. There's a lot of issues to people getting treatment. Is Our peers one way you think we can address the issue more quickly? Or
Yeah,
is it,
yeah.
I mean, but even
I
hearing your struggle, I'm nervous because it took you a long time.
I think so. I think the U.S. peer workforce, primarily the certified peer specialists and all the different endorsements, and there's a forensic peer, there's a family to family, there's adult, there's parent, there's transition age youth, there's just about anything. It crosses over into every single area
Okay.
of the world of life as we know it. So I mean, the CPS gave me hope. The CPS changed my life. When I got my first CPS in Texas, in Austin, in 2007 through DBSA National and DBSA Texas, and it changed my life. I encourage everybody who's on this walk to consider becoming a peer. I was also on long-term disability.
Okay.
I couldn't do I could do nothing. When I was at my sickest, when I was on my knees, I was in ECT for about 2.5 years. I received ECT for 2.5 years willingly. I was trying to kill myself every day for about a year, and so they gave me ECT to zap me out of it, and it did. It worked, thank God, because I really don't want to die yet. And I have things about death and dying that are probably a little bit different than most people,
Okay.
because we've lost so many people. I've lost a lot of people in my life, around me. So I have a different maybe view of death and dying, and the peers. And so peers make a big difference in the market. However, a certified peer specialist is not clinically or medically necessary in a psychiatric environment. We
Okay.
provide recovery and hope and wellness and support to other people who are living with a mental health or substance use experience. So we're not therapists, we're not counselors,
Right. Right.
we're peers. And it's interesting because as I get into social work, I am like clinically, medically involved. And it's not really cool to say that because there's different factions and there's different schools of thought for
Hmm.
recovery community nationwide, as you can imagine. You've got
Yeah.
the middle of the road peers, and you've got the ones over here, and you've got the groups over here, and then you've got everything in between around psychiatric survivorship or anti-psychiatry, and it goes on and on and on. And so the work that I've done with the U.S. peer workforce has taken a lot of hits because they think I'm out to make a buck, and when in fact I see the use and the opportunities for peers to help other people. And for work for the peers, you don't make any money. There's no money in it. I've made attempts to put together telehealth, U.S. peer telehealth networks in a couple of different states. And even if you're billing Medicaid or Medicare, or CMS, or your managed care organizations, and or however you're structuring your business model, telehealth is a good thing. Celia Brown from Surviving Race and I put together the Surviving Race COVID and Crisis Peer Network when Wuhan fell in COVID about 3 years ago now, because they were closing down all the wellness centers in fear of COVID. They were shutting everything down, and people had to go in their homes and were quarantined and
So
stuck
terrible.
at
Right.
home. And
So
so
terrible if you're facing a mental health
it's
challenge. Right.
it's hard. A lot of people really have that to live with every day. And when that's taken away, what do you do? And so we put together programming with a bunch of other volunteer peers nationwide, and we got a sponsor to pay for our use for
Hmm.
one-to-ones, for group supports, as well as webinars. And we did it for 2 years. And I like to think that we set the mold for a lot of people,
Yeah.
a lot of the mental health groups, a lot of the peer based groups, in that we were the first people to actually put programming and use Zoom and use web and WebEx and anything that we could do
Ah.
to help alleviate the pain and the despair of social and community isolation from COVID. It was horrible. It still is horrible. So we did that the last 3 years, and of course I did a lot of my artwork with it because we that's our as a national coalition, which is not an LLC or a nonprofit. We're just a membership group. We've of about maybe 3,000 people now. We've grown a little bit. Um, we don't have any money. We don't raise money, but what we do is we affect change on issues around mental health and living as a peer. And what I like to do is work around health disparities and inequities, especially
Hmm.
for people who are of color, for BIPOC individuals. BIPOC is Black, Indigenous people of color. And one thing that I've seen the most working as a peer in the hospitals is that BIPOC men and women are typically the ones that are receiving the most highest acute DSM diagnoses. And I have some ideas to that, why that's happening. So that's kind of where I've gone with my work. Started off in mental health and then peerness and moving on into social work. And now I'm looking at ways that can help a lot of people in a big way,
In a bigger way.
like what you're doing, basically. Help put the message and the information out, and people can access it if they want.
Yes. Yeah. Yeah. Try to
And it
start getting
makes a
that
big,
reservoir.
yeah, it helps, I think. Um, so yeah, and I got to review my first article with this journal on health disparities, which is kind of cool. Um,
What was the name of the organization again? The not the one that's
yeah,
just
it's called the Surviving Race: Intersection of Injustice, Disability, and Human Rights. Celia Brown was a co-founder, and along we worked closely with Lauren Tenney, a lot of other people. The planning team is comprised of Jonathan P. Edwards. They're largely out of New York. Jonathan P. Edwards, Sean Brennan, Tina
huh.
Brooks, Tina Lang, Cheryl Bellamy up at Yale as a supporter. And so one of the things that we focused our attention on for the last year and a half was to produce the dialogues and retreat in Savannah, because it was a dream of Celia to meet in Savannah. And so, we worked really hard to get that going, and she got her dream before she died. So that was a good thing.
That's pretty good.
Yeah.
Do you know how many peer survivors there are? Do we have any? Is there a way to find like
Interesting.
nationwide?
Interesting. Yes, there is. In fact, UT Austin and University of Texas at Austin, a couple years back with the social work school at UT, put together a big report on the state of the state for the CPS in the
Okay.
US. However, that
Okay.
report's about 7 years old. No one's really comprising it because the CPS goes state by state. It's
Yeah,
not
it's state by
uniform
state. Right.
state by
Right.
state. And so, what you want to do if you're trying to find data is like go to one of the larger data gurus, like in the mental health world, that would be like Nev, Nev Jones. Um, and then, of course, SAMHSA's doing some interesting things. Paolo Del Vecchio, who's the new director of the recovery uh, program at SAMHSA, they've renamed everything. Um, they do some good work. I would say that in the state of Texas alone, they have about 4,000 CPSs. In Georgia that are working. And it's possibly larger than that now. In Maryland, I think they have about a couple thousand. In Georgia, here where I live, we have about, I'm thinking about 4, 5, 6,000 people. So when you
Wow.
put that together at the national level, everyone's doing their own thing statewide. Although
Right.
SAMHSA is trying to roll out and discern a way to have a uniform national CPS certification. When we did this 10 years ago, it's like, why do you want to do it again? So, if it ain't broke, don't fix. You don't have to fix it. Because you
Yeah. Yeah.
$24 million from HHS does not mean you have to take it apart and put it back together again. You've got the same thing.
Yeah.
You're still
Yeah.
not helping us. You're still not helping us.
Yeah. It's interesting. I mean, it seems like such a really good solution to a lot of people's challenges, right? Being alone and just like you said, a lot of mental health is just having someone to talk to at the right time, the right words immediately. Like I need a phone call now, and to stop somebody going from to a darker place where it's harder to crawl out of.
Mm-hmm.
Um,
Mm-hmm.
I had a really good moment the other day. I had a, a gentleman that was approached me for work stuff a while back, just like a salesperson, and I wasn't the right person for him. But we chatted about career stuff, and he's ultimately become kind of a fan. He watches some of the shows and he's comments, and he sent me a message the other day, and he said, "I need to talk.
Mm-hmm.
I'm in a rough spot. I'm not having great time. I'm having some bad thoughts. I'm not in a good place. A couple things have happened to set me sideways." And I said, "Sure, let's get on a phone call." And it's funny when we finally got on a call 2 days later, he said, "Actually, after I wrote you that note and after you replied, I feel so much better. I'm already like I'm doing stuff like." He's like, it just reaching out worked, and then you replying worked even more. And so we had a nice 30-minute chat about work. Just
Uh-huh.
talked about his job now, and just about what he's doing and what he could do
Uh-huh.
different, and how to keep sales is a tough job, and how to keep some hope alive, and to
Yeah.
keep plugging. Anyway, it's kind of funny. So just I would imagine being that peer specialist for people, just a friend, and people reach out. And as soon as they say, "I need help," and as soon as you say, "I'm here," man, that's like half the battle, it seems.
Really, it's amazing. Yeah. Do you know there are some people that are doing enormous work around growing the CPS and growing the peer workforce in the US, especially like my friend Laura Rose Masaras, who founded Pure Galaxy. She lives in Salem, Oregon, and does a lot of collaborative work throughout the state of Oregon. She's
Hmm.
been helping with respite, establishing respite with a gentleman called Kevin Fitz in Oregon, and she does amazing work with the legislature and with their community and capacity building and with technology especially. She's coming up with the data with this thing that will be able to establish relationships, which will help grow behavioral health organizations even more with their business models. It's about
Oh,
to
that's
pay off.
great.
Yeah, it's about to happen. And I'm so excited about that. So there's Laura. But yeah, a big part of what I talk about when I do groups as a CPS is
Yeah.
hope. Is hope. How do you keep going? How do you keep going? What do you do to self care? How do you love yours? How do you self love? What are you doing to? How's your sleep? From at the very most
Yeah.
minute,
Food. What's your food like?
go over everything. Yeah, and I think the experience peer is able to come up with a lot of solutions for the person that's needing some support. um like those warm lines now, and they're touting the 988 line, but the 988 line is just an alternative, is a 911 traffic breaker. In other words, have you heard of the 988 line?
Yeah. Yeah. Absolutely.
Yeah, they started the 988 stating that it was going to be peer based, peer centric, and now it's all clinical, necessary, medical. It's all clinical. It's all clinical.
That really should be the CPS people, right?
It should be the peers, yeah.
Yeah, it should be
Which is
peers
why
on the
we've
other
been
end of.
moving so fast to get this telehealth up and running for mental health and for substance use throughout the U.S. in a lot of different
Yeah, I
capacities.
I could see that being, quite, like I said, quite valuable if it's a. I think the peers do, like you said, bring a real different practical look at how things are going, how you're doing as a person, as opposed to working on stuff.
Mm-hmm.
I don't know quite how to articulate it, but I can see the difference between a therapist and a peer
And a
very
peer,
clearly,
yeah.
and you need both. Um,
You do need both, and you need good people that can do everything. Really, you're right. I think peer support is going to go on forever, and I think eventually, just like social work started literally about 150 years ago in New York City, right? And look at where social work is today.
yeah.
And so I think the CPS is going to gradually come up, and it's going to be codified in the labor, and then they're going to unionize, and they'll get more organized, and eventually there will be a national cert with probably SAMHSA as the oversight management training
Hmm.
organization. Um, I project that will probably happen in a matter of probably 3-4 years, maybe less.
Yeah, and if the federal government keeps getting a little harder look at solving the problems, if they really do get their heads around it, they'll allow some national certification, and states will acquiesce and fall in line and let some of this stuff go.
Right.
Therapists, I can see them being a little more sticky on therapists because of the organizations at the state levels will be quite territorial. I could see a lot of silly, stupid politics, and just I'm not going to let somebody else get we're not going to let it too easy because then we're losing money, protecting territory, if like really silly stuff.
Mm-hmm.
Um,
Mm-hmm.
but I think the CPS stuff is potentially could be a little bit wider.
I think it's on its way. There's a conference next month in Seaside, Oregon called Pure Apocalypse. Let me write that in the chat.
Oh, yeah.
Pure. Have you heard about it? Pure
No.
Apocalypse. Are you going? Oh, you should go up there if you can. They're going to have over. I think at this point they have about 1,100 people that are going to be there. This is the largest
Wow.
peer-based conference that's met post-COVID in so long. It's also the 10th anniversary of Pure Apocalypse, and it was started out of MHAA, Mental Health America, Oregon, and this group called PureLink, which is phased out because of the grant. It's phased out, but Pure Apocalypse is largely a peer-based conference
Okay.
meeting, and it's in Seaside, Oregon, and it's May the 8th through the 11th in Seaside, Oregon. And if you're interested, you would check out, you can just Google Pure Apocalypse Conference. And they have the program put together. My friend Bronwyn Franklin is receiving the National Peer Award this year.
Oh,
There's a
that's
woman,
cool.
there's a woman in Oregon who's receiving the state CPS Peer of the Year. I don't I don't know what her name is. I think it's Roberta, I think, but don't count me on it. And they both do outstanding work. So I'm hoping to get up there, although I might not be able to because I'm teaching and
Yeah.
getting into testing at the end of the year in May. And I've been trying to raise money so that I can get there. They had a slew of money in Oregon for scholarships for Peer Apocalypse. However, you needed to be a state
A
resident
state yeah, yeah, state
to
license.
qualify
Yeah.
for it. And so I've
Fair
been
enough.
raising money on my own. I've asked my university, and hopefully they'll be able to help me. And I don't know. I mean, if I'm able to go, I'll go. If not, I don't know. I miss a whole week of work, and unfortunately, that's during testing, the GMAS testing in Georgia.
Yeah, I mean,
I
May
don't
seems
know.
like the timing seems very poor. You wait another month and you've got summer, and teach all these so many peers that work during during school. I'm sure there's a lot of people who are teachers and peers. It's got to be a probably a cross pollination.
I would assume so. Because it's all service, and
Yeah, yeah.
it's all about giving back. And it's kind of a heady thing these days because I'm getting paid what I'm worth now, as opposed to getting paid 18, $15 an hour working as a peer. $15 an hour in Atlanta is not going to pay the bills. You'll barely be able to afford your rent. You'll be going to get food elsewhere because the
Yeah.
certified peer specialist just doesn't command a sustainable level of income for people who are doing
No.
the work. And they assume that because most peers are mental health consumers, in other words, people living with the shared experience who are living on SSDI and who may or may not be afraid of losing their disability benefits. So they cut the average hourly rate down, way down,
Oh, that's
and,
brutal.
and people are afraid to work beyond a certain number of
Yeah, yeah,
hours, or they'll lose their SSDI,
yeah.
which is what's supporting them currently. And so there's a lot of things that we can change. For instance, I'm interviewing for social work jobs as a traveling social worker in Oakland, California. They want to pay me $84 an hour. So I went from $18 an hour as a peer to $81 an hour as a social worker. Do you see the difference?
That makes no sense.
And I'm basically going to be doing the same thing in there, and they're interested in me because of my experience and because of the work that I've done as a peer and also as a person and through
Is
social
it?
work as
Yeah,
well.
yeah. And you've
So there's a lot that needs to be done. There was this gentleman that did a couple of studies. Nev Jones has done quite a few studies on the CPS and quantified quality of life, physical quality of life. How do you sustain a CPS? Well, I've come up with a lot of different ideas, but I get shot down, and there's a lot of what's called peer guerrillaism when your own peers are coming at you from behind and shooting at your back because they don't like what you're doing with peer supports, right? So there's that too. There's all sorts of stuff you could possibly imagine happening in the peer world. It's happening,
Yeah, and I mean, it's just like any other group of
like
people,
everything
right?
else, right?
Yeah, you get a bunch of people together, and there's going to be a bunch of, there's going to be some people who are just stupid, and some people, a lot of people trying to do the right things, and it just takes a few idiots to get in the way. It seems right at times. It's like high
Yeah.
school stuff, right? It's like
It is. It does seem like high school, and I don't
yeah.
I don't like that kind of behavior. It makes me feel gross. I don't like to engage, and I
I
certainly don't.
know.
I don't support it, and I certainly try not to
I like that. I don't support
encourage
this.
it.
I don't support high school. Yeah, high school behavior. It is really obnoxious.
No,
Um,
I
Especially
mean,
when you're trying to do good stuff for people, and everybody can get their head around that, and then but people still feel obliged to act foolish.
I think people forget to be kind. I
People
think
forget
people
to be
forget
kind.
that the easiest thing that we can do is just be kind and nice to one another, really. And remember, oh yeah, I was there. I remember what that was like.
And so many people are going through something. I mean, it's the people standing in line. This is one of my, for sure comments that everybody around you has been through something, and a lot of people around you are dealing with something.
Uh-huh.
So be kind, be gracious, give people some grace,
Yeah.
especially yourself.
Yeah,
Um,
exactly. Be graceful, and that's the toughest thing to do. Is to be patient, and when someone is maybe doing something to, I don't know, harm you or take your money away from the county or from the state or whatever, trying to get your contracts or whatever. I mean that does happen quite frequently. There's a lot of, there's only so much money,
there's
especially
only
during
so much
COVID.
money.
There's only so much money, but there's a lot of mental health money. There's a lot of mental health money. There's a lot more money in substance use than there is in mental health, but there's a lot of mental health money, and there's a lot to go around. And if you can't get a contract with your regional, local, county, state provider or your feds,
Hmm.
then be creative and make that money, get that money. Go and
Yeah,
sponsor
fine.
it, go create it,
Yeah,
go make it. Because there's a lot of money coming down in for mental health.
yeah.
And so I
Otherwise,
don't
people.
believe it when someone says, "Oh, I can't afford it." No, 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 no. I'm not going to buy it because I can go out in the streets and I can raise $2,000 for an event in Savannah in 5 minutes, and there's a way that you can certainly help
You.
figure out what's going on for you as well.
Hmm.
I don't buy it. I just don't. Maybe it's because I just don't take no for an answer.
Yeah, you might be a little. You might be cut a little bit different.
Maybe, yeah, I don't know, but maybe I just be nicer. But there's that, and I love being a peer. And people say, "Oh, you're going to be a social worker. You sold out," and my answer is no. I didn't sell out. I'll
Oh,
be able to do a lot more
yeah,
to
yeah.
help more people in a different, bigger way than I ever could as a CPS. Because as a CPS, you're pretty much got your hands tied with what you can and can't do.
Hmm.
With a social worker, I can go everywhere, and as long as I'm doing what I should be doing and being a good person and treating people well and have a modicum of what's good and what's wrong, what's
Right.
right, what's wrong, then I'm fine. I think a lot of people don't have an understanding of what's right or wrong and how to
Maybe.
treat people well, how not to treat people. I think that happens. It's endemic in the peer community. It is.
You'd hope that they'd figured it out a little bit better.
Yeah.
Um, How about some thoughts? We got it. We're at the end of the time.
Okay.
Um, how about how to? I'm trying to think of a good prompt for closing thoughts, and yeah, maybe it's more about what you're going to do. Maybe just a little bit closing. What are you going to do in the next few months? What's it look
Oh,
like?
sure. Well, I'm teaching elementary school, special education grades 3, 4, and 5. And I'm trying to get a teaching contract for 23, 24. And at the same time, I will continue to work in social work and peer
Some,
stuff. And so that's basically my year. I'd like to get to peer apocalypse. I don't know if I'm going to be able to because of the grade, because of the tests here in Georgia for.
yeah, yeah. You got to do your first job.
So I don't really have a whole lot of plans. I'd like to see what I can do to improve my health,
Hmm.
my diet. I'm working on sleep in a really big way and to increase my circle. I moved here to Atlanta, again, where I used to live, from Valdosta, where I was going to school for the School of Social Work. So I moved up here to join my girlfriend. And I don't know a whole lot of people up here. And so, I'll get more settled and keep plugging along,
Yeah.
really, and try to figure out what we're going to do about surviving race and make sure that survives and sustains itself. Since Celia died, those are the biggest things.
I love it. Um,
Yeah.
I want to make sure I get as much. Maybe offline, we'll chat about how to do some of that stuff and make sure I've got all that stuff in the notes, etc. Jen, thanks so much for sharing. It's really interesting. I learned quite a bit today, so that's kind of pretty helpful for me. And I've got some more. I think a better understanding about the certified peer specialists, and I think it's a real opportunity.
Oh, thanks. I think so too. I think we're on the right track, and you're doing a really good work, and
Thanks.
you're opening it up to people in the communities all over the place. That's terrific, and I'm going to go and look at your other ones that are recorded or archived.
Yeah, go have a
And
look.
I'll put it out there for you too.
Yeah, this show will be live right after we're done. It'll be recorded on LinkedIn, and then
Oh,
we take
nice.
about 7 or 10 days, and you should be also on Apple and Spotify, the typical kind of podcast
Wow, how
style.
cool is that?
Yeah, we do the full show now. Thanks,
Nice.
thanks so much, Jen.
Thank you, Ken. Take care.
Yeah, don't go anywhere. I'll see you in the other. I'll see you in the other
Oh,
room.
okay. And call me for.
Yeah, loose, baby.
But we're about to go and make this vessel with these great professionals in public glass. We're not part of the community, but we're from the outer family of glass blowing. Yeah, we're going to go make a magical giant jar with optic lenses so that if you turn it, it changes all the time. So if you change the way you look at things, the things you look at change.